We're going to talk about diabetes and sugars, how sugars, called carbohydrates, affect diabetes, so that diabetics can understand, the people that take care of diabetics can understand how these carbohydrates called sugars can affect diabetes. So we have, among the carbohydrates, we have different classes called monosaccharides, we have disaccharides, we have oligosaccharides, and polysaccharides. And these different classes of compounds affect how the blood sugar behaves and how well diabetes is managed and controlled. This is Dr. Luke Aneke, a physician, having practiced in New York for over 30 years. I'm familiar with and have interest in diabetes and how to control the sugar and manage the disease. So let's talk about monosaccharides. These are the simplest of the carbohydrates. It's mono because it's one sugar unit. It cannot be broken down into simpler sugars. Like the disaccharides can be broken down into monosaccharides, oligosaccharides can be broken down, but monosaccharides are the simplest type of sugar. The prototype monosaccharide is glucose. Glucose, the carbohydrate we eat, bread, yam, potato, the body digests it, absorbs it as glucose. And after absorption, glucose enters the blood. And from the blood, let's check this out. From the blood, glucose enters into the cell where it is going to be used for energy. And glucose enters into the cell in based on two conditions. That one, insulin is present in the blood, and the cells are sensitive to insulin. So with these two conditions, insulin being present and the cells being sensitive to insulin action, allows the glucose to enter the cell. And glucose enters a chemical pathway called glycolysis, where it is energized with phosphate molecules from ATP, and then glucose, being a 6-carbon compound, is broken into half into 2 3-carbon sugars that continue to be processed down to a metabolite called pyruvate. In doing that, glucose generates for us energy currencies called ATP and electron carriers called NADH, and a substrate called pyruvate that can also give us other compounds like acetyl-CoA or lactic acid. So this is what happens to glucose when it enters the body. After the monosaccharides, the next class of sugars are the disaccharides. The disaccharides, as their names indicate, they contain 2 monosaccharides. We have sucrose, for example, made up of 50% glucose and 50% fructose. We have milk sugar, which is lactose, made up of 50% glucose and 50% galactose. Then we have malt sugar, made up of 100% glucose. It has 2 molecules of glucose in 1 molecule of maltose. So we are already stated, as already stated, the glucose from the disaccharides go into the blood, and from there they enter the cell and they enter their glycolytic pathway and get broken down. But the fructose in the sucrose and the galactose in the lactose, they go to the liver. In the liver, they are converted to metabolites, and those metabolites can now be used to put in the pathway of glucose to generate energy or build glycogen or used for lipids. They are converted to acetyl-CoA, which can be used to build lipids. The important thing to note about the disaccharides is that maltose has 2 molecules of glucose and has a higher glycemic index. It can make sugar spike higher than the other disaccharides. So that has to be borne in mind by a diabetic that uses maltose. Then the next class is oligosaccharides. These have monosaccharides between 3 to 10 in 1 molecule of oligosaccharide. And they are broken down to glucose and utilized in the body. The important thing about the oligosaccharides is that some of them are what we call prebiotic. They provide food for beneficial gut bacteria in humans. And these gut bacteria use oligosaccharides like galacto-oligosaccharide or fructo-oligosaccharide to generate short-chain fatty acids that are useful in reducing insulin resistance, enhancing insulin sensitivity, and controlling blood sugar absorption so that they don't have a lot of spikes that cause insulin to also spike. So it's important to know that there are oligosaccharides that are useful in maintaining control of the sugar. So the next class is polysaccharides. An example is glycogen in humans. In plants, we have cellulose and starch. But in humans, glycogen is broken down to glucose. It is a storage form of glucose when the body doesn't need all the glucose that it's receiving from the intestines. The body will store part of the glucose as glycogen in the muscle and in the liver. But when the body is short of glucose, it will break down the glycogen, first glycogen in the muscle, then the glycogen in the liver, and then use that glucose to put in the glycolytic pathway to generate energy. So, in summary, we have monosaccharides, we have disaccharides, we have oligosaccharides, we have polysaccharides, and the principal monosaccharide is glucose, to which most of these other classes are broken into. After the monosaccharides, we have the disaccharides. We have sucrose, which is glucose and fructose. We have lactose, which is glucose and galactose. Then we have maltose, which is glucose and glucose. And then we have the oligosaccharides and the polysaccharides. So it's when somebody talks about sugar, it's important to know what he's talking about. Blood sugar is glucose. It's also called dextrose. Table sugar is sucrose. It has glucose and fructose, 50% each. Milk sugar is lactose. It has glucose and galactose, 50% each. But malt sugar is maltose. It has 2 molecules of glucose, which means it has 100% glucose and can affect blood sugar levels more than lactose and sucrose. That's the takeaway for the diabetic, to know how much of a particular sugar he or she can take and be able to control the blood sugar, and it doesn't get out of hand. This is a simple way of helping your blood sugar levels stay within range. Thank you. If you found this useful, please give us a thumbs up and click the subscribe so that you can see more of our tips. Thank you very much.